Hi, this is Larry Belt with Go Medicare Insurance Plans. The purpose of this video is to train you to shop for drug plans every fall. And there's nothing like being able to do it yourself in terms of being able to see what your options are. So it's an important thing to learn to do if you can, and then you can help your friends. So first thing you want to do is go to Medicare.gov. And this is going to allow you to enter a list of your medications, so have that list ready, including quantities and dosages. So you'll be entering that list, and what will happen when you're done is you will get a window that will list how the drug plans will cover your medications from most cost effective to least cost effective. And obviously we all want the most cost effective. Don't shop by premium, and don't shop by what your neighbor has. Shop by your medication. So that's our mission today. So when you're at Medicare.gov, you want to slide down here to find health and drug plans. We're going to be looking for a drug plan, obviously. And put your zip code in here. Simple enough. Don't fool with this down here. We're not going there. Now you've got to answer 3 questions here. And to get to where you need to be most quickly, answer no to that, answer no to this, and yes to this. I'm creating this new video in the fall of 2018 because Medicare has added this selection here. So from this point, we'll get to what we're trying to do, which is add our medications today. So right now I want you to look at this box here. This box here is something, once you've started to enter medications, will now fill up with your information. So you're going to want to save this in case you go back. Don't save it now because your stuff's not in here yet, but your current profile is what will allow you to go back and look at this again without having to re-enter all your medications, and it works pretty good. So we're going to start with the first medication, which I'll put Lipitor, common cholesterol medication, and I'm going to put my own dosage on there. Let's do this by month, okay? It's easier to switch to a look for 90 days after you've put the 30-day in. So do 30 days, even though you're getting it for 90 days. I stress that. And put retail pharmacy in. We can always look at the mail order once we're done. Now, anytime you enter a generic, if there's a less expensive, anytime you enter a medication that has a generic, if there's a less expensive generic, they're going to throw that up there. If you don't want the generic, don't expect any of the plans to cover the non-generics. So we'll put that in. That's the first one. And now we've got this information here. You can save this at this point. You want the ID list and the password date. So at some point, save that. So next thing I'm going to do is enter a medication for diabetics, which is Humalog. And you'll see there's 2 choices here. There's more than 2 choices, but this would be in the traditional vial, receiving insulin in the vial, and this would be by pen. And the key thing to know is not the units per day, but the amount of pens and the amount of dials or the amount of vials per month. So I'm going to put the quick pen in because most people are going with that. If yours has a slightly different name, make sure you know what you've got. So again, the default is that people will generally buy this 5 pens per month. So we're just going to add that right there. Okay, so you can see that's been added. And down here, if you want to change your dose, add it or remove it, you can do that at this point and at a later point too. So I'm going to add, we've already done that. That's the atorvastatin, that's the Lipitor. Hydrochloride is a common medication a lot of people are on. Again, you can choose your dosage, your quantities. Stick to the monthly supply. A lot of times you can generally order a 90-day supply of most medications. It's rare when you can't. This is a medication for acid reflux, very common. Again, we'll add that. And I'm going to add one more, just to make things interesting. I'm adding Flonase, which is a common allergy medication, nasal spray, and what you're going to see is it's not going to come up. The reason for that is Medicare now wants you to buy that over the counter. So we won't be able to buy that on a Medicare plan. Medications that are available over the counter are generally going to be discontinued from drug plans, both Medicare and non-Medicare. So just keep that in mind. So instead, I'm going to enter a blood pressure medication, and I'm going to back up here a minute. As you do this, you'll see the importance of knowing the full name of your medication. Generally, when there's a slash like there is here, that means it's two medications combined. So make sure you know exactly what you have. Look at your bottle or the printout from the drugstore. And I'm going to up this a little bit. So at this point, we're going to say we're done. You may have more or less medications. It depends on the individual. And I want to stress there is no one right drug plan for everybody. It's based on the medications you're on. So we've completed that there. And now it's time to select the pharmacies and open this up. That way, if you go up to 4 miles or whatever the most is in your zip code, you'll get the greatest look at the most amount of pharmacies. And I would strongly advise that you use CVS as one because they are a preferred pharmacy with most plans. So add CVS. From this point, you can add your current pharmacy. You can look for it here. You can see there's a lot of independents in here. And just see how it stacks up. If you're kind of wide open in terms of a pharmacy, I would add a Walgreens. So we're going to add that. We've got these two here. They only allow you to add two. So it'll give you a comparison of how the two differ. And when you do select a drug plan, know what pharmacies are considered preferred. Most plans have preferred pharmacies. Okay, from this point, we want to look at drug plans, not at health plans. I'll have another video for that for people that are on Medicare Advantage plans. So we're going to continue the plan results, and we're going to see what we get, okay? Again, if you haven't already, save this info. This will allow you to go back in, and I'll show you how to do that when we're done. Okay. What has come up here is kind of a rarity. A Cigna plan came up as most cost effective. So what they're saying is for the rest of the year, based on the medications that person is on, that the cost would be $322, okay? And mail order is not really any cheaper. It is with this plan, so we're going to delve into this plan a little more, but the plans are making deals with the pharmacies to get you in the store. So saving by mail order isn't always a great solution. As you can see, mail order is not that much cheaper, but a lot of people want to do that for convenience sake. So we're looking at plans in order of cost here. And there's no one right plan for everybody, as I said. And you can see, this is an expensive plan here at $72.60, but it's about the bottom line. This plan, even though it has a high premium, is coming in low because we're towards the end of the year, and it has a zero deductible that you have to meet. So probably if we were shopping for January 1, which a lot of you'll be doing, you wouldn't see these plans coming up as most cost effective. By October 1, we will have the opportunity to select a plan for next year or this year. It'll give you that option, but it will default to next year, 2019. We didn't have that option at this point because it's so late in the year when I'm creating this video, but I want to get it done before October 1. So we're going to go into this plan. It's so close, and well, let's go into this plan here and see how it works and talk a little bit about that. Some of the plans don't work with agents, so you won't be able to enroll with me, but if that's the case, I'm going to let you know. Aetna plans, AARP plans, Blue Cross, Humana, and Envision RX are plans that I work with. Usually it's the more popular plans, the plans that come up as most cost effective. So let's look at the information here. The drug plan premium is $47.30, which again is a high premium comparatively. The plan has no deductible, and these plans without deductible usually come out as most cost effective towards the end of the year, but rarely at the beginning of the year. So you can see the difference in cost between the different pharmacies, and in this case, CVS is not a preferred. But this will allow you down here to look at the costs between the three options here. Now this is a 90-day option. If you're looking at costs as we put the meds in for CVS and Walgreens, it's 30 days, but basically all you're going to do if you get a 90-day supply is triple your copays. Now this is your copays right here for your various medications right out of the gate. And what you're going to find is, in some cases, this is an expensive copay here, but what this plan is trying to really do is help this person with Humalog. So you may be able to get your medication by not using your plan cheaper. I think Myers has this for a zero copay than actually using the plan. So this person's 4 medications have a total monthly total copays of $98.16. If this person were going to get a 90-day supply of their medications, obviously this would be $45. This would be about $13 and so on. But for somebody that's on a lot of generics, this plan is probably not going to come up as most cost effective because the copays for the generics are really high with this plan. Now, so we should be looking at Walgreens a little bit cheaper. So you can see the atorvastatin calcium is $4, hydrochloride. So these are more in the normal range for cheaper generics, and you can see this says preferred here over for CVS it's standard. Now let's look at the mail order. What really happens is your copays are going to about triple. So the Humalog is now $126 for a 90-day supply. And saving you some money there because it's $42 here on a 30-day supply. But so we're at $60 here retail per month, and we're at $185 for 3 months mail order. So no real savings. And this can show you what your costs are going to be per month. And mail order, you can see it's high in this month because you've gotten a 90-day supply. So if you go back over to Walgreens, you're going to see your copays are $60 a month. And down here, this represents your monthly premium, that cost, and this is the total cost per month. So this is helpful if you're looking for the whole year. If you go into a deductible and out of a deductible, it'd be very helpful to look at that. But October 1 is when you'll be able to shop for next year. Now, if we go down here, we find rules about the medications and so forth, but this will tell you if prior authorization is needed and if there's any quantity limits. But normally quantity limits aren't a problem because your doctor won't overprescribe that, okay? Step therapy is when they want you to use a cheaper medication first, so take a look at that, but generally you won't encounter that on common, less expensive medications. Now, here's where you can go back and edit. in this, change dose, remove, add. Um, if you'd like to remove a pharmacy or change a pharmacy, you would click here, okay? And that's going to allow you to change pharmacies here, okay? You'd first remove one and then search for a new one here, okay? So I'm going to close this window, and basically that's really the end of the information that you'll see. It'll allow you to compare different plans quite easily. This plan is only rated 2 out of 5 stars, and generally this doesn't mean a lot, but in this case, yeah, and you can ask my advice about plans and so forth, easy to work with, etc. None of them are a dream, and some of them are a little easier to work with than others, but none of them are really a dream to work with. So remember, retain this information. And at this point, I'm just going to get out of this. I mean, I could just copy this and then save it somewhere else. That's one way of doing it. Now, I want to show you how to go back in and relook up your info, okay? So I'm going to copy that. I know today's date. I know my zip code. And so we're going to get out of it and go back in, okay? So what we're going to do to relook up our info is put our own zip code in there, find plans, act like you're starting over again, the bottom button, and the top button just like before. Okay, from this point we're not entering medications, we've already done this. We're going over here, and I'm going to paste that drug ID list in, or you can manually type it. I'm going to use today's date. We've got our zip code right there, and this works almost every time. It works surprisingly well. So there we are. You've got your medications back up there. At this point, you can add medications, you can remove medications, and so forth. So it's valuable to go back in and look at it. And you can save this information year after year. You can use it next year. You can use it in the middle of the year if all of a sudden you're getting a cost that is higher than you remember what it should be. And usually that happens when somebody's not going to the preferred pharmacy. So I'm going to say goodbye now. If you've got questions about how to enroll in a plan, get a hold of me, email me, text me, or get on the phone. But the plans I generally work with are the ones that work with agents, which would be Aetna plans, would be plans from Humana, AARP, and Envisions RX. Other companies like Cigna don't work with agents, and I think it's always nice to have an advocate and work with an agent if possible, but not if it's going to break your bank. So I hope this has been helpful, and have a great rest of the day.